Surgical removal of the anal sacs in the dog is a very common procedure that we perform. In order to understand the technique for removal of the anal sacs and the complications that can occur, we first of all need to look at the anatomy of the area. This picture depicts the perineal region of the dog. We have the anal opening and the external anal sphincter muscle. The anal sacs are colored in blue, and these sacs are small balloon-shaped glands located in the anal sphincter muscle itself underneath the skin. They have a small duct that opens onto the anal opening, and during a normal bowel movement, the anal sphincter muscle contracts and these glands are squeezed like an accordion, producing a discharge onto the fecal material. However, we tend to see many problems with anal sacs in the dog. One of these is that these glands can be infected and can actually abscess and rupture, or the glands can produce so much secretion that need to be constantly expressed. In these cases, we consider surgical removal. What's involved with surgical removal is the gland is removed with its duct in entirety from the anal sphincter muscle by making an incision on each side of the anal opening. Post-operatively, these dogs can be a little bit uncomfortable. However, they can be kept comfortable with oral pain medication, which is prescribed post-operatively. The most common things we worry about following the procedure are the surgical sites, which are closed after surgery, opening up due to post-operative infection, which can occur in 10 to 20% of the time, but also being very cognizant that we remove all of the anal sac. If any sac is left behind, a fistulous tract can develop to the exterior, requiring a second surgery. The third complication which we worry about is fecal incontinence, which actually occurs on a very infrequent basis. It is very common, though, to see some dogs drop some stool from the anal opening due to spasm of the anal sphincter within the first week to 2 weeks after surgery, because the anal sacs have to be actually dissected from the anal sphincter. Most dogs, however, recovered and the incisions have healed in approximately 1 week post-operatively.